Hey guys, Dr. Duff here with Terry Chiropractic in Boulder, Colorado. And today I want to spend some time talking about digestion and specifically what are some of the common digestive conditions that we see here in the office. So one that's very popular and you've probably heard before is called GERD, gastroesophageal reflux disorder. And that can cause symptoms like feeling acid reflux going into the stomach, pain and discomfort in the stomach, all the way through the throat, into the heart, feeling heartburn all the way up, and feeling that acidic feeling. And the cause of GERD, there are many different causes, but what we look at here at TCB is we assess the spine and the nervous system, and specifically the nerves that start in the upper neck area, okay? Also the upper back area, and those are the ones that innervate all the organs associated with this one, GERD. And specifically speaking about the esophagus and also the lining and then the stomach function as well, we want to make sure that there's no postural distortions or misalignments that are causing pressure on those nerves and altering the function of those organs. Another really common one that many people have heard of is IBS, inflammatory bowel disease. And this one is a lot more difficult to really get a grip on what the cause is. And a lot of times it has to do with the motility and contractions of our small intestines to move food through. And the small intestines are actually innervated by nerves that start in our mid-back area. So whenever we see things like a hyperkyphosis or any misalignment in the mid-back area, we can assume that there's nervous system stress on the areas going to the small intestines. And so adjusting and getting in better posture and working on that can definitely help with IBS symptoms and increase the motility of food throughout our digestive system. We also have a big one here, constipation and diarrhea, and that's a function of a little bit lower in our digestive system, and it deals with a lot of the nerves in the low back area. So I've noticed this many times that patients that come in with things like back pain, they also have altered digestive function as well. And that can cause constipation, sometimes even leading to hemorrhoids or diarrhea that leads to that kind of thing. And if there's inflammation in the nerves in the low back, that can alter the function of our lower digestive system, okay? The large intestines all the way down into the colon. So we'll definitely focus on that area for anybody with that. Bloating and gasiness, and this is a big one as well. It's like every other person feels bloating at some point in their life, and that's going to be a lot more of the stomach function, and again the thoracic spine, and all of those nerves need full nervous system function, full life energy to that organ to make sure that the stomach is properly digesting the food as it enters through the small intestines, continuing along to our tract. And one of the autoimmune ulcerative colitis and Crohn's disease, having an autoimmune component to it can be very difficult to assess and diagnose as well. Obviously imaging is very important for these to see what's happening, but this inflammation that builds up around the linings of our digestive system can cause these symptoms and diseases. And for ulcerative colitis, it'll a lot of times be like left-sided flank pain. Crohn's disease will often represent a little bit more on the right side. And this chronic inflammation that happens in the gut can create a huge amount of issues in people's bodies. And it can be hard to diagnose and hard to treat. And in our office, we do have a lot of patients that experience this. So we do a full exam with anybody with any digestive difficulties and really figure out what the source of the nervous system stress that alters their digestive function is. And then we can begin to start treating those. And we'll regularly record and kind of check in on how the symptoms are going, and hopefully we start to feel better digestion, or it happens less often as we progress through our treatment in fixing the spinal cord tension and the nervous system tension as well. So honestly, we could have a 25-minute video on each and every one of these, but this is something that a lot of our patients come in here to address, and this is something that can be helped with chiropractic care. So if you have more questions about any of these, feel free to navigate through our website, reach out to us through email or a phone call, and I'd be happy to talk a little bit more about all of these and how we might be able to help.